Hello, and welcome to this episode of NeuroRestorative Radio. My name is Tommy Treadway, and I'll be your host. I have Jennifer Jello joining me today to discuss specialized neurorehabilitation services. Jennifer Jello is the Program Director of NeuroRestorative's Outpatient Treatment Clinic and Clubhouse in Standish, Maine. After an early career in higher education, Jen dedicated the next 15 years serving individuals with disabilities, a happy and unintentional detour that resulted after crossing paths with a gifted young boy with autism. Jen joined the NeuroRestorative team in 2016 with a mission to bring hope and healing opportunities to individuals with acquired brain injuries and their families. Welcome, Jennifer. Can you tell us a little bit about neurorehabilitation, why it is important, and at what point a person should seek out neurorehabilitation services?
Thanks, Tommy. Neurorehabilitation is really just a fancy word. The prefix neuro relates to the nervous system, which includes the brain. The definition of rehabilitation is really just to restore something to or someone to its original state. The etymology comes from the Latin word habitare, meaning make fit. So you're probably wondering why I'm starting off with a language lesson. I mention this because after sustaining a brain injury, it's really quite common for someone to feel like their old life does not fit. One minute a person has a spouse, a job, a vehicle, and then they wake up in the hospital. Their spouse has left. They're not working. They're not driving. Somebody else is in charge of their money. This scenario is really a reality for many people each year. On top of that, the person may be experiencing changes in their physical functioning, changes in the way they feel or act. They may not remember as well. They may have difficulty speaking or formulating words. So a neurorehabilitation program can't change what happened, but a good program will be aimed at recovery and goal-directed to reduce the impact of the brain injury. So you asked at what point should someone seek out a neurorehabilitation program? And to do that, we should kind of look at the timeline. So some event happens, a car accident, an aneurysm, a stroke, and there's this period of hospitalization, which is focused on medical stabilization, coming out of the coma, preventing secondary infection. And then around the time of discharge, the possibilities facing families can really be as shocking as the original event. How is the person going to live? What is the person going to need in terms of care, nursing level care, supported living? What type of continued therapies will they need? So, and this is really overwhelming. There's often this perception by families of what I like to call the cooked spaghetti model of medicine. So maybe you've experienced this when cooking. If you want to know if the noodle is cooked right, you throw it against the wall and you see if it sticks. And the same principle applies in our spaghetti model. The doctor is like the chef that knows best, and medical professionals come in and they're going to throw a bunch of services at the person and they're going to see what sticks. And there's really many things that aren't great about this picture. So we're going to throw neuropsychological services at you. We're going to throw physical therapy, speech therapy, rec therapy, art therapy, and then we're going to see what works. Imagine being in that position. You're a healthy, functioning person that goes to the doctor once every 10 years, whether you need it or not. And now you're faced with 15 different services, a cadre of specialists, multiple medical appointments every month. And then on top of that, we've now reduced you to two terrible analogies. One where we're trying to rehabilitate or make the person fit into an old life, and the other where the person is the wall. It's not an uncommon sentiment for someone to express that he or she just wants his life back. Some will eventually regain what they feel is some semblance of normalcy, and some will have to learn to live differently. In the last few decades, there have been a lot of new thoughts about the way we approach brain injury and disabilities in general. First, since the famous Olmsted decision in the 90s that provided that people can choose to live in the community over institutional care, we've seen the emergence of something called person-centered planning over the medical model. Now, this doesn't mean we're not going to consider or heed medical advice. It just puts the person's needs and desires at the forefront rather than having an expert dictate how life is going to be based on available resources or the lack thereof. The second is that there's more literature and research out there about neurorehabilitation and neuroeducation. In 1984, a guy by the name of Kraft, and I know this because I Googled it, pointed out that there are two ways to look at, or two roots of the word education. One means to train or to model, and the other is to lead out from within. So rather than looking at a person with a brain injury as a person that has to fit into some existing societal construct, like an empty glass that we must fill, new models are looking at a person's gifts and then capitalizing on those. So it's like the old cliche, the imprint for the oak tree is already within the acorn. So what a good neurorehabilitation program is trying to do is to lead out the expression of that which is within.
Can you explain why all these services might be necessary?
That's a good question. I once interviewed a job candidate, Nick, for a rec therapy position, and I asked him some version of that same question. And he said, it's pretty simple. The physical therapist is going to get you the physical means to get out of bed. The occupational therapist is going to help you figure out how to get out of bed. And the rec therapist is going to make you want to get out of bed. And I thought that was a pretty great response. He got the job, of course, but not because of his concise answer. It was really because he had a clear understanding of how therapists with different disciplines can work together towards the same positive end. One of the nice aspects about NeuroRestorative's neurorehabilitation outpatient clinics is that we have an integrated approach to therapies. So at our neurorehabilitation clinics, we have a team of therapists at the table, therapists trained to work with brain and spinal cord injuries. They work as a team. They meet monthly to review progress with everybody in the room. They establish goals together in alignment with what the individual wants. And there's a sort of carryover and continuity to each therapist's approach. So there may be a speech therapist that is working with a person on speaking, reading, writing, or swallowing. There may be an occupational therapist that recommends an assistive device that would help the person be more successful at home, an adaptive device that could help the person compensate for one-sided hemiparesis, or help develop some compensatory strategy because the person's memory is not what it used to be. And although the speech pathologist is working on speech things and the OT is working on OT things, it's helpful for one to know that the other has been using a mnemonic to help the person remember. Then there can be carryover across the disciplines. And then we have cognitive therapy. So remember that after a brain injury, some part of the brain tissue has been injured. The neurons and the synapses may have been damaged, and the brain may heal and restore those bridges in the damaged area, or it may have to find new pathways. So cognitive therapy addresses that, and the therapist may work with a person through stimulation, repetition, to improve memory, to help the person sustain attention or relearn how to problem solve.
What options are available for a person who may want to return to a productive lifestyle, but may not necessarily want additional clinical supports?
NeuroRestorative just opened the first brain injury clubhouse model in Maine. And the name is deceiving. It's not a recreational facility with a pool table for adults like adult Boy Scouts. Rather, the clubhouse is a way that people can develop pre-vocational skills. It's sort of a next step toward independence and community reentry. So we work in the clubhouse on overcoming barriers to employment, which could be as simple as learning how to stay on task, to developing some kind of reference in the community through a consistent volunteer role. We're pretty excited about it.
Thank you, Jennifer, and thanks everyone for joining us today on NeuroRestorative Radio. For more information about NeuroRestorative, please visit us at neurorestorative.com and consider signing up for our Neuro Institute, which offers free 1-hour online CEU opportunities every month. You can find more information about Neuro Institute at neurorestorative.com/institute. Until next time, thanks for joining us.